to Strictly Business. I'm Nancy Carlson. Today we're visiting with Dr. Robert Polisky, a dermatologist here in Elk Grove, right across from Alexian Brothers Hospital. Welcome to Strictly Business.
Thank you for having me.
Well, it's nice to be here. Okay, what made you get interested in dermatology?
Well, during my residency, I had a wide exposure, being that I'm board certified in internal medicine and in dermatology, all the medical specialties from cardiology to GI. However, once I saw Derm, I fell in love.
That was love at first sight for you?
Correct.
Right. And how long ago was that? How long have you been doing this?
Well, it was about 25 years ago in my residency that I saw that dermatology is a very visual field. Unlike internal medicine with lots of tests, x-rays, and scans, we look at a patient and within a few seconds you pretty much know the diagnosis.
Well, I guess that would make it more interesting perhaps for you?
Interesting and very satisfying for me and for the patients.
Right. So you say 25 years ago. How long have you been in Elk Grove?
Well, 20 years ago I was driving down Bisterfield Road. It was a lot smaller then, a lot quieter. I found the ideal location across from Alexian Brothers Medical Center.
Right. And it's grown up around you, hasn't it?
It sure has.
Right.
It seemed almost like a cottage hospital at the time. We used to walk across Bisterfield Road without a light.
Right.
And before the 53 interchange. But then we developed many positive things at Alexian Brothers, everything from the new cancer center to daycare and on and on.
Right, right. So, who are your patients? Do they come primarily from Elk Grove or?
I'd say so, and from Elk Grove and a radius all around it. But the nice thing about dermatology is you get everything from the little children all the way to the seniors. Men, women, pregnant patients. We have a wide variety.
Yeah, so you don't have to narrow it down to any one category. You're here for everybody.
That's right, and we have a lot of variety during the week, Nancy.
I can imagine. Right.
Everything from serious skin rashes, teenage acne, adult complexion, and even cosmetic dermatology.
Right. Well, I understand we're going to get an opportunity to see some of the things that you do here today.
Yeah, I look forward to showing you around the office.
Well, let's do that.
Great.
The love we have for our pets is unconditional, and the idea of their loss is a devastating one. In the event that you lose your pet, call the Elk Grove Non-Emergency Police Desk at 847-357-4100. If you found a stray animal, it's okay to call 911 so that police may make an attempt to find its owner before turning it over to Hollywood Kennels. Make sure you've got a county license as well as a village animal license for all your pets. Show them how much you love them.
Okay, doctor, we've moved into a room now. I see what looks like a cosmetic counter here. Can you kind of explain where we are and what goes on in here?
That's right. The Elk Grove Derm staff put together a room where we could examine patients such as Laura and find out what cosmetic goals she might have.
I see.
Tried to make it a little friendlier and also to show scientifically by Visio computer analysis what 6 features of her face may need correction and on what percentile basis does she stack up against people of her same birth year.
Oh, wow. All that from one little photo.
That's right. And our nurse who's in the background, Rose, may be showing you soon how we break that one photo up into 6, giving the patient a printout in a more scientific and logical way of understanding their cosmetic concerns.
So Laura could take this information that she gets and use that when she's purchasing cosmetics, or is that
purchasing cosmetics, but also selecting cosmetic procedures. For example, Laura's skin is looking quite good, but let's suppose she had acne scars or some aspect of the skin that she wanted correction of. Whether it would be facial hair removal, facial freckling, or unwanted skin growths, she'd be able to objectively look at her photo.
Wow, that's interesting.
Another interesting thing, Nancy, is in the older patient, you'll find varying degrees of sun damage. One of the biggest things in dermatology is encouraging patients to stay out of the sun and protect them. But once they've had that sun damage, they have everything from wrinkling to fine lines even hyperpigmentation, which we call too much skin melasma. And we have goals and treatments for those, but unless we can objectively show that we're improving them, we don't get as good of a feeling.
Now, is this something that would be primarily for women?
Well, interestingly, a growing number of local males are taking part in everything from Botox to repairing fine lines and wrinkles as well.
Everybody wants to be Mr. Dreamy. McDreamy, I guess it is. Well, that's interesting.
Now the cosmetics, it's interesting you mention that because when the staff brought these in, I was a little surprised how popular it would be with acne patients. Many times it's difficult to motivate the young acne patient because she feels so bad about her acne scars or marks. A brief cover-up allows them to have the encouragement to go forward with their acne regimen.
So you have someone here who can help the patient pick out the right type of cosmetics?
That's right.
And they can purchase them also from you?
They can purchase them or purchase them on their own, but they can learn about them. It's also invaluable for the patient who's had a procedure. Everything from a facial laser to a facial skin treatment with redness following it. Feels embarrassed to go back to work, but once they have a little bit of the right color makeup balancing it, they're ready to go.
Well, that's very neat. You think of dermatology, but I've never thought of it going to that, that extent. It's very interesting. Okay, are we moving on, or are
I'd
we?
like to show you one thing. I'm going to bring Rose here. She's a registered nurse, and she's been invaluable in working with the patients. Typically, she will sit right here. Get the printout, which I'll bring over.
Oh, I haven't printed it there.
Such as something like this, and then candidly discuss with the patient their goals. Of course, at that point, I will leave the room, let them speak, and I may come back later to find out what they've concluded.
Very nice. Okay, doctor, obviously we've moved to another room and it looks like there's some kind of surgical procedure going to go on here. Why don't you explain what's happening?
That's right, that's a big part of our week, Nancy. Dermatologic surgery. We'll be doing that 2 to 3 times a week, taking up everything from small moles to large skin cancers. We'll even freeze off certain growths. And we do little children here, even seniors sometimes in their wheelchairs. So it allows us to get patients out of the hospital and into a more controlled office setting.
Right. So why don't you explain the procedure?
Okay, we have a nice patient. Her name's Sue. How are you doing today?
Good, doctor. How are you?
Oh, fine. And we have Jen, who's a physician assistant. We work together. What we'll generally do is explain a little bit about the patient even before they come in for their surgery, so they already know what to expect. Then we'll numb up the growth with a local, and it can come off in a minute or so.
Okay.
Using sutures when appropriate, but many of the athletic patients would rather have no sutures. They can go right back to the gym.
So what's the alternative then to sutures?
Well, we've developed a method where we lightly shave off the growth, and it's appropriate for some growths, and it fills them very well from the bottom up.
Ah, okay. All right. Well,
I just wanted to show you, let's go, we'll show you one other aspect. It's very important to be precise. What we're doing is a lot of precise measuring of the growth in millimeters. Once we have that, Jen will be numbing up the growth, and a short time later, it'll be removed. Patient will get their post-op instructions and will be out the door probably in 10 to 12 minutes.
wow, that's very streamlined.
I wanted to show you one other thing, Nancy. Could we get the cryosurgery? Here's a growth that doesn't even need cutting. We may just freeze it with liquid nitrogen, so Jen will show you how we do that.
Doing okay?
I'm good.
And that's appropriate for warts, small growths, and even certain freckling and age spots.
So that is just actually a freezing,
Right.
and the patient feels something just like something cold.
Exactly.
Okay.
Later, that growth will take very minimal care, so it's also good for patients who may be traveling. One thing that's not seen in the picture between these two surgical rooms is something called a Mohs unit, and that allows us to carefully get the edges of a skin cancer